Good evening. Thank you for joining us tonight on our virtual town hall here for Mary Washington Healthcare, addressing the COVID-19 in the Fredericksburg region. Mary Washington Healthcare is committed to improving the health of the people in our community, and we take this commitment seriously and know the COVID-19 pandemic continues to raise many questions and concerns for you and your family. Tonight, we are here to share what we know about COVID-19 and what we are doing to keep you safe and healthy, especially as we near the holiday season and winter months. During this town hall, you will hear from our expert panel and welcome you to ask questions in the chat during the conversation. Let's meet our panelists. First, we have Eileen Dohmann, Chief Nursing Officer. Next, Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer. And finally, Dr. Mike McDermott, Chief Executive Officer. Dr. McDermott, I'd like to turn it over to you to start the program. Can you tell us about the numbers that we're seeing here in the Fredericksburg region?
Yes, thanks, Lisa. And thank you, everybody, for taking a little bit of time out of your evening to tune in to our town hall. As everybody remembers, back in the spring, we held these fairly regularly to keep our community up to date with what we were seeing with COVID-19 here in the Fredericksburg region. We wanted to be transparent and open with everybody, and it's some recent developments in the trending that we're seeing with COVID-19 here in our Fredericksburg community that have kind of raised the alarm and have caused us to want to reach out again to our community and have a town hall to tell everybody what's occurring. I'm going to bring up a screen from one of our dashboards that talks a little bit about what we've seen with COVID-19 really throughout the entire pandemic. And so the dashboard dates all the way back to March and all the way to the left of the screen, and you'll see a bunch of squiggly lines there. And I'm going to kind of walk you through what some of these lines are. The first line I want to describe is the yellow line that you'll see there. That's the number of patients that we have hospitalized here at Mary Washington Hospital and Stafford Hospital, really on any given day throughout the entire pandemic. You can see we reached highs approaching 30 patients back in May, and then again in June and in August. But here near the as you can see to the right of the screen in November, we have blown past our total number of patients that we've ever seen in the COVID crisis here in just the last week or so. And currently, we have 44 patients hospitalized between Mary Washington Hospital and Stafford Hospital who need inpatient care to help them battle COVID-19. That's the most we've ever had at any point in time of this pandemic. The orange line that you see on the graph is that uses the scale over to the right of this graph. And that's the number of inpatients hospitalized in the Commonwealth of Virginia, all Virginia hospitals at any point in time of the pandemic. And you can see now here in the last couple of weeks, the slope of those graphs. Our graph here for hospitalized patients at Mary Washington Healthcare and the orange line, the number of patients hospitalized in the Commonwealth of Virginia, from November 1st until now, the steepness of those graphs increasing is extremely concerning. And it's what brings us all together here to this town hall to raise this awareness with our community. Back in the spring, we talked so much about flattening the curve, right? Flattening the curve is reducing the slope and making it not so steep. And we're at the point in time again, I know we stopped talking about that through the summer, but we're at the point in time again where we need to talk to our community about taking the tactics that we know we can do with one another to flatten the curve. And so thank you for showing this graphic. Flattening the curve, we know the things we can do here in our community when we have increased prevalence now, which means it's more likely than ever that somebody we're going to encounter in our community has COVID-19 than at any point in the pandemic. It is more prevalent in our community than it's been at any point in time. So what can we do to keep one another safe? Number one, stay home. Don't leave your house or go into any other environments with strangers or people that aren't part of your household if you don't have to. Anytime you're outside of the household, whether it's indoors or outdoors, where you might see somebody else, please wear a mask. Masks, we know the data. Not only does it protect others around you, but you are protected more as well if you are wearing a mask. Keep distance from others, right? Whether you're indoors or outdoors, social distancing, keeping our distance from one another increases safety. If you do need to be in an indoors environment with others who are you're not part of your daily household, limit the time that you spend in that environment. The time plays an important factor, and make sure you are wearing a mask and limit the time. It's one of the reasons why our town hall format is different today. Eileen, Chris, and I, and you, we're not in the same room with one another. We can't do that safely any longer, even wearing masks. If we're going to spend an hour with one another in an environment like that, it's just not the safest we can be with one another. So we're leveraging technology. We're doing it virtually on Zoom, but we're all in separate spaces, not in a room with one another, because it's just not safe to do that. And another reason to raise awareness is here we are heading into the Thanksgiving holiday, when I know everybody wants to be around their family and their loved ones to share thanks with one another. I understand that as well. I have a big family. I have 6 brothers and sisters. Every Thanksgiving we get together and we spend time with one another, but we're not doing that this year, right? We've called off the in-person Thanksgiving with one another, and we're going to leverage technology. We've done FaceTime calls throughout the pandemic a few times. We're going to do it again on Thanksgiving to spend some time with one another and share what's going on in one another's lives, but we're not going to be joining one another in person. It's just not safe to do that with anybody really outside of your daily household unit. And so I'm encouraging our whole community heading into Thanksgiving, please share Thanksgiving only with your daily household unit, those that you lived with under a roof every given day. If you're planning, I know everybody thinks they have a plan where they're going to do it safely, or we're going to thread the needle, or I figured out a way to keep everybody safe. I think we all need to be honest with one another that there is no real safe way to do that. And I also know nobody wants to be a party pooper when the plans are in place and be the one to pull the plug on the plans. But I guarantee you, everybody that you might have plans with is wondering the exact same thing right now, because everybody is seeing in the news about the increased prevalence of disease really throughout our entire country. And it's happening right here in our Fredericksburg region. And we're seeing it with hospitalizations in our hospitals. So I'm imploring our community as we step into these holidays, it's the actions we take one another this week that are going to dictate really the Christmas season. And so I think we can all take these actions with one another now to limit our Thanksgiving and leverage technology so we can have a brighter Christmas with one another. And that's what I encourage everybody to do.
Thank you, Dr. McDermott. With all of these numbers rising and everything happening in our own community, Dr. Newman, can you talk to us about the types of patients we're actually seeing in the hospital? We hear so often, oh, this is just a disease that really impacts our elderly and those with risk factors, but we might have a different story than that.
Yeah, definitely. There's no question that severe illness does correlate with advancing age. But what we are seeing in reality in the hospital is an even distribution of 40-year-olds, 50-year-olds, 60-year-olds, 70-year-olds who are in our hospital with very serious illness. And when you look at pre-existing conditions that really set you up for a risk of very severe disease, it's not uncommon things. It's being overweight. It's diabetes, hypertension, heart disease, things that are very, very common amongst broad spectrums of our population or community. So it's not unusual to see people who in their 40s, 50s, 60s get very, very ill and require hospitalization. Another subset of younger patients that we have seen on and off over the entire pandemic that have gotten very critically ill are pregnant women. That's another very serious risk factor. And we've seen hospitalized 20 and 30-year-olds with COVID very, very ill with pregnancy. So it is not just old people that need to be concerned.
And we're also seeing that some sicker patients are arriving in the hospital. We're seeing some high acuity, what we call high acuity or sicker patients that are non-COVID as well. Why is that happening?
Yeah, this is a trend that we are seeing across the entire country. I've spoken to peers, through various meeting forums at hospitals across the country, and the levels of ICU level patients requiring critical care are higher than we've ever seen at Mary Washington and higher than they've seen across the country at other hospitals. What we're postulating is this is from people delaying care. So, they've forgone care for cancer diagnoses or heart disease treatments or others, and now they're finally presenting with very advanced disease. They're presenting very sick and requiring a lot of high-level intensive care, which is straining resources outside of COVID.
Thank you for that explanation. And is it still safe to come to the hospital?
Yeah, again, we have done an enormous job at trying to keep people safe. I would still say this is probably the safest place to come because of all the parameters that we have put in place to keep people safe. For a lot of our scheduled procedures, there are strict testing protocols. We're wearing masks and appropriate PPE. We're limiting visitations. We've controlled our entrances. We have high-level air filtration systems with negative airflow and filtering of the air. So it really is a very, very safe place, and there is no reason to delay getting care. In fact, the people who have delayed care, we're now seeing kind of catastrophic advanced levels of illness, and we don't want to see that. That's the second tragedy of COVID right now.
Thank you. And Eileen, can you tell us a little about how our staff are holding up?
Our staff are doing amazingly well, but they're concerned too, and they're anxious because they are, seeing the same things that everyone else is seeing as far as a greater prevalence in our community, and they're seeing people not being careful, and they're on the caregiving end, and they're the ones that are seeing how sick patients are with COVID, and it's not an old person's illness, and I think that adds an extra level of stress for healthcare workers, is knowing that if people aren't careful, somebody who's your neighbor today could be a patient that we're taking care of tomorrow. And I think that's why it's so important to us tonight to really reach out to our community. And this is a call to action. We have the ability to slow down this disease. We have the ability to flatten the curve, as Dr. McDermott said. We've done it before. And we cannot waver. Because again, your neighbors today could be patients here in our hospital in 3 weeks, and patients in our ICU could be your neighbor in a couple of weeks. Don't do that. It's the simple things. It's hand washing. It's wearing a mask. It's not going into public places with other people unless you absolutely have to, and then absolutely making sure that you're wearing a mask and limit your time. You remember back to our early, town halls, what Dr. McDermott said. It's how much time that you're exposed, and it's the proximity. So we need to do the things that we know how to do, and we can flatten the curve, but it will only happen if every single one of us responds to this call to action.
Our nurses and caregivers are healthcare heroes, right? And they are so thankful for the outpouring of support our community has shown to them for the hard work that they're doing every day. And so I would implore everybody who's listening tonight, reach out to one friend, family member, or somebody else and implore them to take the tactics they know we can do to stop the spread in our community for the sake of our nurses and caregivers here in our hospitals. Please do it for them. They're asking you to do it. Keep everything within our capacity to care for everybody in our community that needs care. Please do it for our healthcare heroes.
Yeah, I'm so proud of our respiratory therapists, nurses, frontline staff, docs. This has been a very long slog, this pandemic for them. It is exhausting, and please, flattening the curve really protects them and protects our capacity to care for you when you're sick. But I just want a big shout out to them. They've done unbelievably well through this long, hard slog.
Yeah. Thank you. And Eileen, we are entering into what's commonly flu season, and many people are confused about flu symptoms versus COVID symptoms and what can they do. So can you give some advice on what people should be doing to prepare for these winter months?
Get your flu shot. That's the best thing that you can do to protect yourself, is get your flu shot. Because we know there's lots of work and great things happening for a vaccine for COVID, but that's not here yet. But a flu shot is. And so every single person should be making that a priority to get your flu shot. At least protect yourself against what we know that we can. And then when you have symptoms, it's important to make sure that if you're not feeling well, and maybe you might think it's allergy symptoms, but we're hearing even from our health department partners that people that are thinking it's just allergy symptoms indeed are COVID. So if you're having any kind of symptoms, reach out to your healthcare provider, but then also don't go out. Don't expose others to what you may have. So it's really just being prudent to protect yourself and to protect everyone around you.
One additional point to add there, because it comes up sometime when people talk about testing. Maybe you do have a symptom, like Eileen said, allergies, or you get a headache and you don't typically have headaches. Your suspicion should go up. And if you do get tested for COVID, please stay at home and await the result before you don't go about your normal daily activities awaiting the result. Consider yourself to probably be positive until you hear otherwise, right? And take actions like you're positive. We hear so many times people say, well, I got tested and then I went to the grocery store or something else. Like, don't do that, please. If you need to get tested, await the results before you undergo your normal daily activities. And even now today, we're asking you, limit your normal daily activities and only do the things that you absolutely need to help us flatten the curve again. We're trying to flatten the curve at this point.
Thank you. That's really good advice. We're seeing a number of questions coming in from our community viewers. I'd like to switch over to some of their questions. The first is that in the event that we have more COVID-19 patients in our area than we have hospital beds, do we have a plan in place? What will we do at Mary Washington Healthcare?
Yeah. So we're in conversation regularly. I know both Mike, Eileen, and myself are in conversation with our peers across the state. So I think the first step would be transfer of patients to areas that are hospitals that do have capacity. But as Mike showed on that first graph, things are ramping up very severely, and that's in all regions of the state. So that really just underscores how important it is to flatten this curve now and not put the healthcare systems in that position. I think we have capacity here. We have plans to create capacity. We had our field hospital. There are different things that we can do. But the biggest issue with that is staffing. There are so many ICU trained level nurses or ER level trained nurses or ICU level physicians. So that's the limited resource that gets spread very thin. And, all those professionals are exhausted. They've been working so hard since the beginning of this, and don't put that extra strain on them if at all you can help it.
We've seen those areas of the country where, unfortunately, they have exceeded capacity. New York City early in the pandemic, in the Dakotas now, and other places, they are exceeding the capacity of their healthcare systems to care for their communities. And we don't ever want to be in that position here. Mm-hmm. And so that's why we need to take these steps that we know can help flatten the curve. Wearing masks, limiting our travel, all those sorts of things, social distancing, hand washing, hand hygiene. We know what we need to do as a community to stop the spread. It's within our capacity to do that. We need to reach out now just to make everybody aware. Here's what's happening in our community. It's time to sound the alarm again and really take those tactics to heart to help us flatten the curve here in Fredericksburg. We want to stay well within our capacity to care for everybody in our community that needs the care that they need to have a better health outcome. And that's why we need to take those tactics now, reinforce those with everybody in our community.
Thank you. When this whole thing started, we reached out to our community and said we need masks. And we asked for 5,000 and we got 4 times that many. So this is no different. This is a call to action, but the call to action is something that every single one of you can do, which is wear your mask, social distance, wash your hands.
Yeah, thank you. One of the questions that have come in is that, we're hearing that not all the numbers are accurate, that maybe there's some chance that hospitals or nursing homes might be saying, because you have COVID, regardless of the reason why you're in the hospital, that means that your number is a COVID death. Is that accurate, Dr. Newman?
That is not accurate. That is, really a myth that has been propagated for several months that I've heard this, and that hospitals and health systems are testing everyone so that they can, make more money and trump it up. Hospital systems are being financially devastated by COVID. We're not making money off of COVID. The cost of care, COVID patients in the hospital require very long lengths of stay. They require a lot of resources, a lot of staff, ICU level care. There is no financial incentive in COVID. We're in fact here pleading for the community to stay safe so we see less of it, and that we're able to take care of people. The numbers are not inflated. They are accurate, and they're very concerning, especially how steep that curve is currently in Fredericksburg.
Thank you. And are we seeing fewer deaths later in this COVID season than we had been maybe in March or April or May?
Yeah, the death rate has decreased. As we've learned more and more how to take care of folks, that come in critically ill, and we have more treatment options that are being successful. We are preventing death at a higher rate than previously. But that again, if our capacity is overwhelmed to provide standard level care, that's where we see the devastating death rates, as we saw in Italy, the tragedy unfold, as we all saw in Washington State, in New York City. We do not want that here in Fredericksburg. So really, we have to keep it within our capacity as a healthcare system. And we've been there for most of the summer. It's been busy here with COVID. We've been under our capacity to care for people, and we've been able to safely do that. We've done a good job. But my fear is we are hitting a steep trajectory here that we may be overwhelmed in the next few weeks. And we're really pleading for people to be safe and prevent that from happening.
No. And people are asking about testing in particular. How do I get testing? Where do I get testing? Is there drive-through clinics, or do I go to my doctor? Do I go to urgent care?
We have many options for testing at this point. So most urgent cares, including Mary Washington urgent cares, have testing, and the test results are coming back more rapidly. We are working to get access to what's called antigen testing, where results come back in a matter of minutes to an hour. We have in-house testing capability that we're able to get rapid turnarounds for those coming into our emergency rooms, to our hospitals, people sick enough to be admitted. We do have drive-through testing capabilities in Stafford and out on Route 3. So we do have a couple locations, and we are working multiple times with the health department and National Guard and others to do testing of underserved communities as well. So there's lots of options. Most PCPs have access to testing. So really, if you are having symptoms, it's critical that you get a test at this point. Previously, we told you to stay home because we didn't have the testing capability. But now you need to get tested, so even if you're not getting critically ill, you want to make sure you don't cause somebody else to get catastrophically ill. So you need to know that test result.
Thank you. We even had a drive-through testing clinic with the Rappahannock Health District at our Stafford Hospital location just today.
That's right.
So we have many options.
Many options.
And people are worried about their own safety. We're talking about a lot of the things we talked about early in the process, because what we didn't know and now know. And so they're asking, is it safe to go to the doctor? Is it safe to go to the grocery store? Should I be hiding in the house again? Help us understand what might be the safe ways to proceed through those daily activities.
I think we need to limit our daily activities. One of the reasons why, when you look at the rapid increase in spread and prevalence, and the increase again in hospitalizations, which lags that to a certain amount, when you see that increase, you have to think some of that can be seasonality, right? And us being indoors, like a lot of this corresponds with the change that happened to the loss of daylight savings times. Maybe we got together with our neighbors to have a dinner indoors when we would have done it outdoors when there was more daylight outside. There's a whole variety of factors that you could postulate that could be leading to this increase. But we do know that somehow we've let our guard down a little bit to let this prevalence increase in our community. Either we're not wearing masks all the time. We thought it could be okay. We were being less vigilant in a way. Well, with the increase that we're seeing now, we need to get more vigilant, right? We need to get back to the tactics we know that can flatten the curve and make it safe again. That involves wearing masks all the time. I would ask you to wear one as an example to everybody around you that, hey, I care about you and I'm trying to keep you safe and I'm trying to stay safe as well. I think it's a great statement. If you're going to be around any other individual in any way, shape, or form, indoors or outdoors, you should have a mask on and encourage everybody to do the same thing. And limit your distance, keep your safe distance. All of these things we know are going to drive the prevalence down in our community and make it safer for everybody. It's time we take those tactics again and we bring them back to front of mind, and we all commit to do it for one another, for our safety of everybody, that for ourselves and everybody that we care about. That's really why we should be making this commitment now.
Well, and don't you think we need to challenge ourselves? You know, when do you need to go out and be somewhere where you're going to be around other people? Going to the grocery store. Do you have to go to the grocery store? Can you have your deliveries, your groceries delivered? Can you do curbside pickup? There's so many options that are available to us. So why put yourself in the potential of harm's way? Keep yourself safe. You don't have to do those things, so don't put yourself in that position.
With our numbers rising, do we know how the other hospitals in our market are doing, say Spotsylvania Regional? I know we don't often have access to their numbers, but is there any understanding of what else is happening around outside of our region and in here?
I mean, outside of our region, I am aware they're seeing similar, very steep trajectories. I personally can't speak to the numbers at Spotsylvania Regional. But I do know that in Northern Virginia, Richmond, Western Virginia, across the state, they're all seeing the same very steep trajectory. As Mike showed on that initial graph, Virginia hospitalizations are, I believe, past an all-time high at this point.
Yeah, there were times in the recent prior months where the prevalence in Virginia was happening in more rural communities. Well, it's swinging back around again to the urban areas right now. Northern Virginia, our Fredericksburg region, Richmond, the other urban areas are really seeing increased prevalence right now. It's it's why we have reinstated these community town halls. We need to ring the bells with our community, let everybody know what's going on here, what we're seeing, and ask everybody, please, for the safety of everybody in our communities, start taking those tactics seriously again. Wear masks, limit your activities, social distance, hand hygiene, all the things. Stay in your normal household. Do not mix households or individuals amongst households. That's one of the riskiest things that can happen, whether it's our children or spending an evening with another family. Those things are very dangerous right now with this higher prevalence that we're seeing in our community. Really, we're talking about limiting activities to your daily household, those that are under your roof, and spend the evenings and the nights at your home. That's really where you should be limiting most of your activities at this point with this higher prevalence in our community.
Thank you. Early in the start of all of this, we had to make the difficult decision of limiting things. We limited elective surgeries and outpatient procedures, and we limited visitation. Do we anticipate needing to do any of that now that we're seeing these numbers going up again?
I think the visitation policies are always flexible here, and we're adapting those to the needs of our facilities to keep everybody as safe as we can. And so I think those are likely to face some changes in the ongoing days and weeks ahead as we face this higher prevalence. And I think that's appropriate. Safety is our primary concern for all of our staff and all of the patients under our care. As far as the elective surgeries, one thing we did show early on in the spring is how quickly we can build capacity, because when we stopped doing those elective procedures, we had a tremendous amount of capacity here in our hospitals, and we're fortunate at that point in time, we didn't need that capacity to meet it. But I think what we've proven now is that we can tailor individual service lines to create the capacity that we need, but we're asking everybody in our community, don't make us do that. We don't want to stop somebody from receiving a healthcare service that they need to get a better health outcome for themselves for the sake of the capacities we need to create to care for COVID patients. And so we can control that as a community. And that's why we're imploring everybody today, start taking those tactics again to keep this within our capacities so that everybody that has a healthcare need can have that healthcare need met. That's really what it comes down to. But we can tailor and thread service lines that are needed to help us face the capacities that are in front of us. But we can all take tactics so that we don't need to do that. And that's what we're asking everybody to do here today.
Thank you. The next question is about vaccines. It's hard to say much about vaccines yet since they're not here. But what do we know about the vaccines that are coming? Are they effective? For how long? Are we going to have vaccines here in Fredericksburg? Can you speak to that, Dr. Newman?
Yeah, so the data is very preliminary at this point, but there do appear to be at least 3 different vaccines that have shown very significant promise and are undergoing, FDA emergency use authorization. And after it gets through the FDA process, that's when we'll have broader indications. But on all 3 candidates, the preliminary data looks that there's 90% plus efficacy, so they work 90% plus of the time, and very good safety profiles. So very promising information on all of those. There's some very significant logistics surrounding some of these vaccines. Some of them require 2 doses given 3 weeks apart. One of them requires to be stored in an ultra freezer, 70 below 0 Celsius. So there are some very significant logistical factors around it. We have a team here that is looking, and we will be ready to distribute once we receive the vaccine. We're in contact with the state, and we will be ready to distribute it for our region. And we don't know how many we're going to get at first or what the timing of that will be. In all likelihood, the first round of vaccines will go to first frontline healthcare providers and first responders. That is likely the first, and then it will likely go to those at higher risk. So elderly and pre-existing conditions, and then eventually the broader population. From what I'm hearing is the vaccine may or may not get through everybody until late next spring, early summer. So there is still some time before we're in front of this from a vaccine perspective. But the initial results are very promising, and I'm optimistic that this will be effective going forward.
Thank you.
That's another thing to keep in mind is in the spring when we were talking, the tunnel was longer and darker, right? And so now our tunnel, we can see some light at the end of the tunnel, and it's right in front of us. And it's so why if we take these tactics again now, wearing the mask, social distance, limit the time we spend with strangers or others that aren't in our household, we can flatten this curve one more time, and we're likely to have in front of us additional protective devices to have us not have to do this again, and to get back to what some would say is a more normal social activity in our country. But we need to do this one more time here. There is some light at the end of the tunnel, hopefully. There's some very good data coming out here. We're all very, very optimistic, but we're making one more plea to our community. Hey, now is the time to start reinforcing mask wearing, social distancing, limiting the time we spend with others outside of our household. The time is now, especially heading into this Thanksgiving holiday, like we spoke about earlier.
Thank you. So for people who are admitted to the hospital, who receives a COVID test, and how do we determine that that's the course that we take?
Yeah, we're no longer testing everyone who comes into the hospital. We're testing people who are suspected, so people who have symptoms. We're testing people who come from congregate living settings, so where people live in close contact. That could be anything from a nursing home, a prison, or a college dorm, where people live in close contact, because that's a very high risk. And we're testing individuals undergoing high-risk procedures, such as heart surgeries requiring general anesthesia or something like that. So those are the broad categories that we're testing of individuals coming into the hospitals.
And do we have enough PPE and medication needed to keep people safe while treating the rising number of patients?
Where we are right now, yes. And we've been very fortunate, but please don't forget, just a couple of months ago when we were talking to you about how difficult it was to get PPE and that there wasn't an adequate supply, things could change very quickly. And as we see the numbers going up across our state and across our country, we could find ourselves in another PPE crisis. And there again, the reason is we don't want to go there. So keep us where we are now, as we keep saying, we're within our capacity. We can handle this. We can take care of our community. But please don't push us to a place where that capacity gets exceeded, and we don't have the PPE that we need, or we don't have the capacity, the ability to care for our community. So wear your mask, wash your hands, socially distant, then we don't have to be worried about having a conversation about will we have PPE. We'll flatten the curve.
Thank you. Now, when people talk about PPE and masks, they'd like to know face shields are not as effective as masks. True or false? Is how it was said.
Yeah, face shields are an added protection. They are not a replacement for a mask. So sometimes I'll see people wearing a face shield out, but you have to remember the air gets out around that. It's not the same as a mask. In the hospital, in certain settings, like our ICU, where there could be droplets coming out, if it gets into the eye, that could be an infectious. If a very sick patient coughs in a nurse's face, that could be a vector of infectiousness. So even though they have a mask, they need that face shield to prevent those droplets from getting in the eye. I think out in the community, face shields are likely unnecessary. You should be staying 6 feet away from people you don't know. But masks are very necessary, and face shields do not replace masks.
That's right.
Thank you. Are we treating patients, I'm not going to be able to say this, with the new medication that was just approved that we lovingly called BAM internally because I cannot pronounce it?
Amivantamab.
Thank you.
Amivantamab.
All right.
So we are in the midst of working on operationalizing that, as other hospitals across the state are. So that technology is now becoming available in very limited supply. So we will, as we have it, we will communicate that to our community, but we're working right now to have that up and available for our community.
Do we have any information on children and their likelihood of contracting and spreading COVID? Is it the same as an adult, or is there something else we should be considering?
It's not. So the risk for children, and this is maybe one of the blessings of this disease, is that children are very low risk of severe illness, and they appear to transmit at lower rates than adults. So I think everything from teenagers up, we have to have some concern. It's not no risk. Children certainly can transmit, and children can get sick too, but it is certainly not at the rates that we're seeing in adults. It's much different.
That's the relativity part, right? Where there is still some risk, and you could have a young child who gets COVID and transmits it to others. So it's not zero risk, or just like, oh, kids aren't affected. They are. The rates are different relatively, right? And that's what's important to remember. So, even with children, they can have COVID and they can transmit, right? The rates are different than with adults, though. I think is what to keep in mind. It's not, you can't make broad statements. No child will get this or transmit it. That is not appropriate. The rates of transmission are different relatively in different populations.
Thank you. So for patients that are hospitalized and are COVID positive, is tracing required? And if so, how is that done?
The Department of Health is working with us on all the positive cases, both either our own associates that may contract and do the contact tracing, or with the patients in the hospital. That is not something that we have been doing. That really, we've been partnering with the Department of Health on the contract tracing and testing side of things.
Thank you. And have we encountered anyone who has had COVID more than once? And is this possible?
It is possible. We have not, to my knowledge, encountered anybody here in the Fredericksburg region or Mary Washington that I'm aware of, but there have been case reports. I did see a fairly large research study just about a month ago that showed that at 6 months, people still appear to have antibodies. About 80% of people still appear to have antibodies at 6 months, but 20% of people do not, or form very few antibodies to begin with. And it's postulated they may be the ones who are at risk of getting it again. So there's a lot of research going on this right now, and I don't know that we can speak exactly on it, but it is possible to get it twice, but I don't think it's a common thing.
And remember, we're not even a full year into this global pandemic yet, and so it's hard to really speak about long-term, multi-year, immunity and those sorts of things. Like, there's just a lot that isn't known yet. I think that's important to keep in mind.
Yeah. Thank you. And are certain cloth masks better than others? You're seeing more on the market that claim to be 2-ply or 3-ply or have a filter. What is the best mask product that someone can use to protect themselves and others?
I think high quality masks, there is some data that shows high quality masks, meaning like, and you can find masks like this that are made out of kind of the poly material, medical type material, have been shown to have some benefit. The more layers to a mask, obviously, the more protective, and you can just imagine the layers between the air you're breathing and the filtration that occurs. So a single layer of maybe a fleece-like material, not as effective as a multi-layer mask with multiple layers that can provide filtration. I think there is some difference in the quality of masking that is out there, and I know some people are urging people to use a higher quality mask to provide greater protection to the environment that you're in and to yourself when you're wearing a mask. Chris or Eileen, I don't know if you have anything to add on that.
No, I would completely agree with that, but I would just add wear a mask. If anything, wear a mask first, and then worry about the quality of it. But certainly wear it and wear it appropriately. I continue to see people wearing it around their chin when I'm out, and really have to cover the mouth and the nose.
Yeah, that's important I think to just say with everybody, right? There's an appropriate way to wear the mask. It needs to cover your mouth and your nose, right? Both of your respiratory organs on your face need to be covered for the mask to be effective for the environment you're in and for yourself. So the whole below the nose thing, it's not effective. And so I think we all need to be vigilant also with how we're wearing the mask device to increase its effectiveness. I know here in our hospital, we peer check one another all the time. And in the community, it might be harder to do that with a stranger, but the peer checking and encouraging everybody to know the proper way to wear a mask, make sure all of your loved ones and family members know the proper way to wear a mask. Those are the things we can all do.
Thank you. We've neared the end of our questions, and I'd like to go to our closing remarks for this evening. So Eileen, if I can start with you, what recommendations do you have for our community as we go into this next wave of COVID-19?
It's a pretty short list. Wash your hands, wear a mask, socially distance. Please help us protect our healthcare heroes so they can be here and take care of you when you and your loved ones need us. And think about yourselves, your family, your loved ones, your neighbors. Nobody wants anybody to get sick, and we have the ability to influence this. We can flatten the curve. Wash your hands, wear a mask, socially distance. Don't be out in public places when you don't need to.
Thank you. And Dr. Newman, what advice do you have to offer?
Yeah, and this is, I know we're all tired and we're all weary, but the end is in sight. As Mike said, there's reason for optimism. We have at least 3 very promising vaccine candidates. We have a couple monoclonal antibody drugs that appear to be pretty effective coming out. So there is hope. The cavalry is coming, and they're coming soon. This is not the time to throw caution to the wind. I think we just need to be careful for a few more weeks to months. Ride it out, keep that curve flat, and then we're going to have vaccines and treatments and all those kind of things. So I think there's hope.
Thank you. And Dr. McDermott, closing thoughts.
Well, just a thank you to all of our associates that are part of our Mary Washington Healthcare team. You are all so amazing. Every single team member here, absolutely incredible. Thank you for everything that you've done through this COVID pandemic. And thank you to all of your families, the families out there listening, of all of our associates here. Thank you for the sacrifices that you have made over the last 8+ months as we've navigated this pandemic here locally. But I was always told, if you want a message to get across, say it once, say it twice, and then say it a third time. And so I'm going to say the same things that Eileen and Chris have said, which is, hey, we see an alarming trend here in our local community. We wanted to share that with our community tonight. The trend line we are on is unsustainable. And so please help us do the things that we know that we can do to flatten the curve. We need to flatten the curve again. Wear your mask, social distance, spend time only with your household unit right now. I know we're heading into the holiday season. It's very dangerous. We all want to spend time with our loved ones, but we can make some sacrifices today so that we have many, many holidays in the future to all spend with one another. So thanks everybody for taking some time out of your evening tonight to spend it with us on this town hall. Happy Thanksgiving to everybody.
Thank you. Thank you to our panelists. I appreciate your time. And thank you to all of you for tuning in to our community town hall and asking such great questions. Be sure to tune in next week, Thursday, December 3rd at 6:30 p.m. for another COVID-19 update with our panelists, Dr. Mike McDermott and Dr. Chris Newman, along with the Rappahannock Health District Interim Director, Dr. Denise Bonds. Have a good evening and have a safe holiday.